Going on our Intro to Compliance series so you can be ready for our Navigation to Compliance series starting November 1st. I'm super excited about it. Have got a ton of positive feedback that it's going to really help you guys. And so continuing on, we're going to talk about, we've talked about what compliance is in senior care. We've talked about who accredits senior care providers. And today we're going to talk about why become accredited. And this is my favorite topic because accreditation is optional. It's not required. It's something you choose to do. It's up to you. You can certainly be accredited by the state and have state surveyors come in. So why would you pay the money to have a surveyor come in and have to meet a higher level of standards? Who would do that, right? So there are a lot of reasons actually. And this is why a lot of organizations choose to become accredited. So the first major reason is knowing you're providing the absolute highest quality of care. So you're meeting the best practices for standards of care. You know your quality of care is guaranteed, and you're going to be really meeting and exceeding that benchmark for doing the best thing for your patients in the community. So it also creates a culture with your staff of a quality mindset. And that's hard to do, but accreditation can help you do that by explaining the rationale as to why you're becoming accredited, why quality is so important, how it impacts the positive outcomes of your patients. And that's huge, and staff know that. Your nurses, and if you have the right people on board, they want to provide the absolute best quality of care to their patients. And when they understand the why behind it, they're a lot more motivated to do it. So, marketing benefits, there's a lot of marketing benefits from accreditation. When your quality scores and your quality is impacted, that makes a huge difference in your ability to market your agency. With those, whether it's a star rating, for a long-term care facility, they have a 5-star rating based on quality. Hospice has CAHPS surveys, and those are going to be published nationally. So all these things, as we get more and more focused on the value and the quality of healthcare, these things are going to be huge marketing opportunities for you. So to say that you're nationally accredited is a big benefit. The other benefit is, you have the confidence in knowing that you're meeting that quality standard, that compliance. It's the compliance survey itself, the accreditation survey itself is a much more partnership approach than a state survey who's coming in to regulate, to make sure you're not violating any standards, to check off the boxes and, say yay or nay, they meet or they don't meet. Now, not all state surveyors have the same outlook on completing surveyors, but in general, a state survey they're looking for areas where you're not compliant. They're in there, they're doing chart audits, they're finding things that don't meet the standards of care. Whereas an accreditation survey itself is a more partnership approach. They're coming in to help show you where you're not meeting or you are meeting. I just had the hospice I'm working with right now, transitioning accrediting bodies from CHAP to ACHC, just had an awesome survey. They only had 3 total deficiencies, so this was a huge win for them compared to their last survey. But they kept remarking how the surveyor from ACHC was really taking a partnership approach where she would help them understand what she was looking for, how they could meet it, why they weren't meeting it, or what they could change to meet it. So I have found personally in my experience, the accreditation surveyors are much more of a supportive and partnering approach than a state surveyor. The other thing is, when it comes to accreditation, you're their customer. You're paying them for a service, and they want to provide excellent service so that you don't leave and go somewhere else. So you could easily transition, if you didn't have a good experience, you could transition to another accrediting body and pay them your money. So they know that that you are their customer and their customer service has to be good. So that can help a lot of times get a better survey experience. And lastly, you're going to have more resources and education. So all three of the accrediting bodies for home care, the Joint Commission, ACHC, and CHAP, all have resources on their website in a client portal where you can access updates to the standards. You can download the standards and review them. You can watch webinars. You get email updates with tips on how to stay compliant, common pitfalls, deficiencies, new updates to regulations, all of those excellent tools and resources that I receive as a consultant, you'd receive as well. So that is a big benefit to being accredited, is that you have more education and support externally, whereas the state is not necessarily partnering with you to provide those materials. They're generally just saying, hey, this regulation changed, figure out how to meet it. Here's the date. So, the accreditation bodies have entire portals dedicated to client success. You usually have an account manager or a client success manager who walks you through your survey. If you have a consultant for accreditation, like myself, I would do the application process for you, with you, to help you get transition to the accrediting body of choice. So those are some great reasons why you should move towards accreditation. Those are some benefits to being accredited. So we're going to talk about how to choose your accrediting body next. Feel free to drop any questions in the comments. I will try to come back and answer them for you. Make sure you're in the Leaders in Senior Care Facebook group, because that is where the Compliance Navigation series is. And I'm excited to get that started. So I'll talk to you guys again soon. Have a good day.